I'm going to go over ABGs. So with ABGs, we want to first look in the patient's chart, verify that the order is present. Look to see if they have any bleeding disorders or are on any blood thinners. If they would happen to be, then that just requires more pressure or pressure to be held longer following your needle stick. So we would enter the patient room, knock on the door. Hello, Mr. Blank, my name is Tricia. The doctor would like to get some arterial blood gases today. This just means we're going to take some blood from the arteries instead of the veins right now. So we do this on the forearm. I'm just going to do a little check to make sure you got some good circulation going, and then we will get that blood drawn. This will kind of show us how your breathing is affecting your system and how well you're breathing today. So go ahead and wash your hands. I'm going to put my gloves on, make sure I have all my supplies. I have my needle, I have my rubbing alcohol to clean the area, my Band-Aid to apply afterwards, gauze for the pressure, and then I have my cork and my device to remove the bubbles from the syringe afterwards. So with the arm, Mr. Blank, I'm just going to check to make sure we have enough circulation in this arm here. So what I'm going to have you do is just hold that arm, just relax it for me, and I'm going to put pressure on both your radial and your ulnar arteries here. And I do have that pressure held. I'm going to have you make a fist with your hand, open and close that 3 times, and I see that the palm of your hand is blanching. So then I'm going to let go of your ulnar artery, and then I see that your color is returning very quickly. We want that color to return within 5 to 10 seconds. So I see that is returning, so we know that we have enough circulation in this arm. And then I'm just going to palpate for the artery, and I do feel that artery there palpating. So I'm going to prepare your site. So I just have some rubbing alcohol. I'm going to rub in a circular motion here to clean that site real well. And then we're going to put your arm up on this little towel here. Sometimes if we extend it just a little bit, it will help stabilize that artery. Sometimes the arteries like to roll just like the veins, and we want to help stabilize that. So just relax that arm, pull that wrist down just a little bit, and I'm going to place my the palm of my hand in the palm of your hand to help stabilize, feeling for that artery, and I feel that right there. So I'm going to get my needle here. With the needle, we're going to pull back at least 5 cc's, if not more, to have that fill. So I've palpated that artery there. I feel that with the needle. I'm going to insert it at a 45-degree angle with the bevel up. So insert that right where I feel that artery there. I should see if blood start to fill the syringe. It should be a little bit lighter, not a dark red from the artery. So it has filled past that 5 cc's. Then as I remove the needle, I'm going to apply pressure. We're going to do 3 to 5 minutes if they do not have a bleeding disorder or if they're not in any blood thinners. Otherwise, we would do 10 or longer. If they do have any bleeding disorders, this needle would go right into the cork, and then we would hold that pressure. We would check the site, and then we would apply our Band-Aid. We would remove that needle, and we would put our syringe into this little device to remove any air bubbles, and then we would get that sample to lab as quickly as possible.